I have lots of old acne scars. Which treatment is most suitable to get at least 50 to 60% improvement? Already went microdermabrasion 8 sessions before 10 years. Peel 1 session. Punch grafting 1 session before 7 years. Dermabrasion fractional CO2 1 sitting only on affected area before 4 years. Microneedling PRP treatment 3 sittings before 2 years. Now on Venus Viva, 2 sittings done, but does not show any improvement. Applying CitriMax cream. Can you suggest combination of treatment to get 50% good result?
Thank you for your question. You've submitted several photos showing the extensive nature of your acne scars, and you provide terrific detail, a timeline that started 10 years ago of all the different things that you've been doing for your acne scars, starting with microdermabrasion, fractional CO2 laser, the use of PRP and microneedling, dermabrasion, punch grafts, and now currently you're using Venus Viva, which is a radiofrequency device which employs the use of microneedles that are penetrating the skin to generate collagen stimulation through the induction of heat. And so you're asking, it's clear that you are frustrated with having done so many things and looking for guidance as to what to do moving forward. Well, I can certainly give you my perspective on your situation. I treat a lot of patients with acne scars. I'm a board-certified cosmetic surgeon and a fellowship-trained oculofacial plastic and reconstructive surgeon. I've been in practice for over 20 years in Manhattan and Long Island. And certainly the frustrations of dealing with acne scars is something that I'm familiar with, and I do spend a lot of time counseling my patients like yourself as to what to do and how and what to expect. It's clear that you are patient and you are committed. You have been doing everything, and literally you have experienced in many ways the textbook on how to deal with acne scars. I think that what you are at least embracing, including with this most recent treatment, is that there is an ever-evolving improvements in the laser and radiofrequency technologies with the ultimate intention is to stimulate collagen. And just as a review, you understand that when you had inflammation and you had the cystic acne that ultimately led to all these scars, what ultimately happened? You lost skin. And so when you look at a profile of somebody who has acne scars, they have ice pick scars, they have rolling scars, they have boxcar scars, and they're basically different ways to describe loss of collagen, the presence of scar tissue, and the complexities of trying to restore volume is always individually determined. Put on top of that, skin type. Some skin is more amenable to certain types of treatments versus other skin types. Now, certainly I would say that there's a common thread in all of these treatments. And the common thread is build more collagen. There was lost collagen, and the goal is to build more collagen. And certainly heat induction is a way to accomplish that. Now, I would say that in my practice, one of the things that I would probably add to your regimen, even though you've had an experience like what you did where you did the microneedling and the PRP, is that I find that use of PRP as an injection within the scars, as well as combined with subcision of the scars, which is subcision meaning going underneath the skin where there's adhesion with the underlying skin and releasing those scars. There is a certain amount of value in trying to improve or remodel the nature of the scars. And so PRP has had value in my practice. I've also combined PRP with injectables. I think that one of the things that is a particular challenge is how much collagen can you induce with all these modalities. Your skin has definitely been heated more than a few times. It has been needled multiple times. You have to ask yourself, where is the reserve? How much more collagen can be generated? So in my mind, before I do a laser device, we have several lasers in our practice that we use, and even lasers for people with darker skin, where we can control the amount of heat that's applied and get a lot of these improvements accomplished. But basically what I try to do first is prep the skin, condition it. Now for a lot of colleagues who are dermatologists, that means use of a retinoid. That means treating basically the epidermis. What I find of also of value is the injection of PRP into the skin as well as under the skin. I think that improving blood supply, collagen, and helping soften the scars preps the skin in a way that can probably improve the results of any further modalities. I think it's very important for patients with acne scars to understand that there is no ideal. There is never a time when you will not have any signs of having had acne, cystic acne the way you had. But there is a continual aspiration or pursuit of improvement. And as in many areas of cosmetic dermatology, there is a continual assessment made of treating and observing results. So I think that you are certainly on a good track when you're having this additional treatment, and you understand that there's time that's involved in seeing results of any collagen-inducing treatment. There may be some value in the use of a fractionated erbium laser with these shorter pulse durations to help with the resurfacing. The reason I choose that is because it has a much less heat dispersion and is less likely to cause reactive hyperpigmentation or post-inflammatory hyperpigmentation, which means that typically we'd prep somebody with a bleaching cream or something, or a hydroquinone type treatment beforehand. There are many ways to treat acne scars, but I think that once you complete your current treatment, you may want to take a step back and just think about comparisons of where you were 6 months from now. Don't go back 10 years, because 10 years is a long time and other facial aging changes occur. A lot of my patients who are a little bit older will have had acne scars, and then those acne scars actually look deeper when their skin gets loose. And when I actually lift their face, it actually looks better when they have a facelift operation. I'm not recommending that to you, but I'm just saying that look at instead of going for percentage descriptions of improvement, compare what you look like before the most recent treatment, and then whenever your doctor states is likely to be the end point or the plateau, and see if there was improvement, and then come up with a plan. I explain to my patients that if you have acne scars, you don't expect any time to have a single treatment or single modality. It's always a combination of treatments and ways to try to maximize results, and it is very subjective. So it requires a good, strong dialogue and relationship with your doctor to feel comfortable. Otherwise, you, like many other people, find themselves bouncing from one practitioner to another, or finding one device versus another. And if you look at devices, you basically all claim the same thing: improvement of wrinkles, improvement of scars, generating of collagen, and it leaves people who are the recipients of all this barrage of information often very confused. So it does take a dedicated beauty doctor to help you navigate these options. So I hope that was helpful. I wish you the best of luck, and thank you for your question.